Hey everybody, Dr. Carly Brown from Ashewell Medical Group. I hope you are all well. I wanted to talk to you a little bit about the integrated behavioral health services that we have at Ashewell Medical Group. We had introduced these services about 3 or 4 months ago, and people are actively enrolling to participate in them. But I thought if I made a little video and explained how it works, it might be a little bit easier for people to understand. We would like to decrease the stigma associated with mental health and believe that it's fully part of your primary care. And thus, decreasing obstacles to care involves bringing it into the primary care office, which is your medical home, and integrating it into our services using a collaborative approach where your primary care doctor works with your mental health providers to basically achieve the highest level of care that you can get. And so we have 2 options here at Ashewell Medical Group. First of all, one should know that we still continue to prescribe medication for mental health concerns, including antidepressants, anti-anxiolytics, stimulant medication for ADHD. Every day, that's part of our bread and butter and what we do. But in addition to those services, now you can have therapy at Ashewell. So Lauren Kaufman, our magical therapist, is available to do 30 or 1 hour minute session, 30 or 60 minute sessions with our patients. And thankfully, you do not have to have insurance, as always, to do this. It is it's for 30 minutes is $50 and $100 for 60 minutes. And she's trained in, multiple modalities and a CBT, EMDR, lots of different kind of dialectic therapies that she can work with our patients through and work through their issues. She does couple therapy, and she has a special interest in patients with physical medical problems, autoimmune issues, cancer, other things like that, so that she can really address the issues that are kind of holding people back in their lives. And our patients have overwhelmingly reported that this has been a wonderful experience. So we highly encourage patients to partake in this. In addition, we also have what we call Thrive Ashewell, which is an intensive collaborative behavioral program, actually behavioral health program that we have brought to Ashewell, which is amazing and I'm very excited about. And what this is, it's a program where you have both therapy and oversight by psychiatry, Dr. Taylor. And so you have 120 minutes of therapy, teletherapy with your therapist, either Justin or Alita, and they basically make recommendations that the psychiatrist then oversees and makes medication recommendations. So, for example, say that you've had depression for many years, and regardless of the medications that you've been on for a long time, you really have not seen a lot of improvement. This is the perfect program for you, because not only will you get the therapeutic intervention, but then you get the specialty psychiatric oversight who can make recommendations for medication changes, which will then be implemented through a collaborative approach with your primary care doctor. So there are many instances in which this is wonderful. Dr. Taylor is incredible. He's our psychiatrist. He also specializes in substance use disorders, so he can work with patients on that aspect. And we really want people just to get the care they need. And so what we feel is that everybody's unique and there's not one size fits all, right? So what we have introduced is 2 very different programs, which hopefully will meet most people's needs. Of course, we continue to send people out, for therapy into an insured setting if that's what they need, and or psychiatric care. Whatever the patient needs, we will meet that. Whatever they need, we will try to meet that need. And I think that's the message. So we hope that you will partake in these programs, try them out, see if they work for you. They're affordable. Our Thrive program is $199 a month, and that's for therapy and psychiatry. That would cost probably like $1,200 without this program a month. So we feel like we've introduced these options in an affordable way that almost everybody can afford. And we are encouraging people to partake and try it out, because what we're hoping is that it will introduce a way for people to get mental health services in their primary care office, decreasing the obstacles to care, which is the entire model of direct primary care. And we hope that this will just bring a lot of health and wellness to our community, our neighbors, our patients. And we're hopeful that we continue to introduce programs that do so. I hope that this video has been informative and helpful. Please feel free to ask any questions. We're happy to answer them. Okay? Be well, everyone.